I'm Debbie Korge, or Deborah Korge, the Executive Director of the Women's Fund Miami-Dade. The mission of the Women's Fund Miami-Dade is to improve the quality of life for women and girls in our community. We focus only on Miami-Dade County. We've been doing this through grant making, research, education, and advocacy. And going forward, we anticipate having a greater presence in the advocacy, research, and education aspect of the organization. Okay. My personal goals are to continue improving the quality of lives of women and girls as we embark on our new collective impact or community impact approach, making sure we're bringing in the best community partners we can on the issue or issues that we identify, so that we can bring about both grassroots and systemic changes. Okay. Right now, we're kind of taking a step back. Our 4 pillars have been economic security, freedom from violence, access to health care, and leadership. If we had to prioritize any one of those issues, we would say economic security is the #1 issue. Yeah. Because if women are and girls are economically secure, the other issues have a tendency to fall in place. Yeah. So that being said, our new initiative is going to be identifying an issue within the framework of economic security where we can bring in the right collaborative partners on a very specific issue, and we're still trying to define what that issue is. Okay. But if a woman has economic security, if they have the financial means, and I'm not talking about living in Pinecrest or Gables by the Sea, or
let's say Coconut Grove.
But let's say they have the financial means, then they're more likely to be able to. They're in a better position to leave a violent situation.
Oh, you mean domestic violence?
And it could be domestic violence. It could be trafficking, and for some people, it could even be bullying.
It could be someone tries to steal your purse.
Right.
An older woman.
Well, yeah.
That does happen.
It does happen. Okay. But our focus is more about improving the quality of life.
Quality of life.
Right.
Okay.
Right. I think right now, from everything I've seen on the stock market, they're not too worried about the stock market.
Okay, good. No matter who they voted for.
Right.
Okay.
I do think, though, that funding on a more administrative side through the state or the federal government it is going to be less available. Yeah. And so as a result, the philanthropic community is going to have to pay very close attention to that and see where and how they can be stepping up to help organizations. We work closely with the Miami-Dade County Commission on the Status of Women, but we don't really, and we have relationships with a lot of the commissioners at the county level, Daniela Levine-Cava, Sally Heyman, Audrey Edmondson, just to name a few, so that when we have challenges, we have issues, we can have that communication, if not directly with them, then with their staff. We were asked in 2015 by Catherine Fernandez-Rundle to bring together all the different entities that are working on trafficking, and there are a lot, to make sure, again, we're not operating in silos, that everybody's sharing the same messaging, that if somebody says, I'm struggling with this, and someone else says, oh, I've done that, well then, let's start talking. What events do you have coming up? One of the most frustrating things to know is that 3 different entities have planned an event, an awareness campaign of some sort on the same day. Right. Where do I go? Who do I? Yeah. And one's in north part, one's in the south part, one's east, one's west.
There's so much going on.
And there's So this is a way for us to say, okay, let's figure this out. Okay. And let's work together. Okay. Yeah. And a little background on the whole sex trafficking initiative. It wasn't on anybody's radar in Miami-Dade County back in 2008. Really? We received a grant application from an organization that was working on it at that time, and we kind of went, what's this about?
Is it young girls
or young girls. Young girls. 9 to 12 is the average age. 12, 13 is the average age. So if that's the average age, when you think about it.
This guy has a daughter. All right.
So we started peeling back the layers and realizing it was a bigger issue than any of us realized.
These are girls in Miami?
Miami-Dade County. Wow. And so as a result, we started, again, research, education, advocacy, doing our research, educating ourselves, advocating on this issue to the point that this collective that we bring together now includes the Hotel Restaurant Association. It includes the school system. It includes Homeland Security. It includes the homeless shelters. It includes the healthcare.
To keep their eye out too.
Right, and as a result of the work that's been done, Camilla's House now has a 14-bed unit only for trafficked women.
Okay, good.
So that when they're able to escape their life, they have a place to go.
Okay.
Jackson Health just opened up a clinic only for trafficking victims.
I see.
So now they're able to get the services that they need as they're trying to get away from that lifestyle or that life. In addition, Catherine Fernandez Rundle has now a dedicated team within her staff that works only on trafficking cases.
Okay.
Judges have been educated on trafficking. Law enforcement has been educated so that when they go into a situation, they're pretty quick to pick up whether it is a more, and I hate to use this phrase, common prostitution environment versus a trafficking environment.
Whether they are a willing partner or
right,
not.
exactly.
That is difficult. I understand that.
So now and what that does is from the day that person is identified, they're not treated as criminals.
Right.
They're treated as victims. So they're not going through the penal system.
They could be thrown in jail.
They're going through the they're getting the services that they need.
Okay.